Today we are talking with the Brown Cancer Center about head and neck cancers. Dr. Melanie Townsend is the expert, fresh out of surgery. We thank you so much for coming on today. Okay, so let's start with the different types of head and neck cancer.
Yes, there's several different categories and types of cancers. The majority of them start in the mouth or the throat. But you can also have cancers that arise in the thyroid gland, in the salivary glands, which live around the ears and under the jawbone. And those are going to be a little less common, although thyroid is somewhat common. And that kind of encompasses all the main types.
Okay, so what are some of the signs and symptoms that someone might notice that could tell you that something's not right?
Yeah, the signs can start subtle, where it is a change in the way your voice sounds, something that lasts many, many weeks, not a few days, or the way that you feel you're swallowing. Sometimes pain in the mouth or the throat or pain going to the ear is a sign. One of the classic signs in an adult is a lump or a bump along the side of the neck on either side or in the middle. And those signs and symptoms can escalate with growth or further trouble swallowing or pain.
And if you do notice something like that, what's the best next step? What are your options for screening, and if it is cancer, treatment?
Screening is generally done through an ear, nose, and throat doctor or a primary care doctor. If you develop those changes or concerns, then go see your primary care right away, or an ENT is a good referral to go see. The general at-risk population are going to be older adults who have a history of alcohol and tobacco use, but it's not always the case. And the treatment options there's a lot of good treatment options. We've made a lot of advancements in chemotherapy and minimally invasive surgery. At the Brown, we have a team of experts who treat each patient individually with a combination of surgery or chemotherapy or radiation, depending on the tumor and the location.
Well, we know you guys have it covered over there, and we thank you for spending some time with us, especially right from surgery. She really did just come from that. Very impressive, and thank you for your work in our community.
Thanks for having us here.
Of course.